The most common is actually probably brain metastases. And what those are tumors that spread to the brain from another location. The majority of brain metastases will be treated with radiation, but those that are too large or perhaps in areas that are too dangerous for radiation may be more suitable for surgery. Another very common brain tumor that we deal with are gliomas or glioblastomas, which are the most aggressive type of gliomas, or in almost all cases actually not curable. But in the last 20 years or 25 years since the Hermelin Brain Tumor Center was started, we've made some very real improvements in the care of these patients. The third common brain tumor that we see are meningiomas. Those, strictly speaking, are not tumors of the brain, but rather of the layer around the brain called the meninges. Most of those are benign, but they can be in bad locations, which make them difficult to treat. Primarily surgery, but there is sometimes a role for radiation and even sometimes chemotherapy.
I'm Dr. Lindsay Lipinski. I'm a neurosurgeon at Roswell Park Comprehensive Cancer Center. So signs and symptoms of a brain tumor can really vary depending on the location and the size of the tumor. Most common symptoms that we see are headaches, nausea or vomiting, visual changes, and any type of focal neurologic deficit, which could mean weakness, numbness, balance difficulty, hearing difficulty. So it really is a wide spectrum depending again on the location of the tumor. And often these symptoms are caused by something that isn't a brain tumor, but those are the types of things that we see most commonly in patients that have a new diagnosis of a brain tumor.
The majority of brain tumors that we see are not genetically linked in any way. They're just bad luck for the patient. If a patient has lung cancer, we know that's linked to smoking, and then that tumor may find its way to the bloodstream and find its way to the brain, so there's a link with smoking and brain tumors. You know, there really is no other genetic environment for certain tumors. There are some genetic traits like neurofibromatosis that will cause a patient to have numerous brain tumors, but those are very few and far between.
The two main types of procedures or classifications of procedures that someone with a brain tumor might have is the first, a resection. That's where the skull is opened up and the tumor is removed at surgery. That removal can be a complete removal or it can be a partial removal, and it depends on the diagnosis and location of the tumor. That particular expectation would be well described by your surgeon prior to surgery. So you would have a feel for exactly what was going to transpire. The reason why someone would have a removal of the tumor versus, say, just a biopsy is because the tumor had was a mass and was causing pressure on other areas of the brain such that removing the mass would be helpful in terms of reducing the person's symptoms and also helpful in terms of controlling that particular tumor. The second type of procedure is called a stereotactic or needle biopsy. That is generally used in situations where the tumor may be very deep, it may be difficult to access to remove, or it may be in a location where if it is removed, the impact on the person's quality of life or function would be significant, and therefore that risk is not worth taking for that particular problem. These are usually tumors that are intrinsic in the brain, that are deeply located and may not have a lot of mass associated with them such that there's not a lot of local pressure related to the tumor. That particular type of procedure involves a very small incision, a very small little hole that's placed in the skull, and then using imaging and computer guidance, a needle is guided down to the middle of the lesion. Small pieces are taken and then the pathologist looks at those to make the diagnosis. So the goal of that type procedure is just to get diagnosis. There is no removal of tissue in that of substance in that particular procedure.
For the first exercise, you're going to find a sturdy chair. Bring the band with you and sit on the band. Keeping your arms straight, Raise the band above shoulder height as high as you can. If you can't raise it very high, that's okay. You'll notice this improves with time. Do 3 sets of 10 on the first side and then switch to the other side. If you have trouble holding on to the band, loop the end of the band around your hand prior to starting. Exercise number 2, the hip abductor exercise. For the second exercise, find a place to lie down. Tie the band together, about shoulder width apart. Lay on your left side. Bring your toes forward and raise your leg above 45 degrees. Do 3 sets of 10 on this side, and then lay on your right side and repeat. Exercise number 3, the quad exercise. For the third exercise, you're going to lie face up on the pillow with the band around your legs. Raise the first leg above 45 degrees with the toes pointing toward the ceiling. Alternate legs to make this exercise go more quickly. 3 sets of 10 on each leg should be sufficient.